All right, I'm starting to hear the beeps stop, and for those that are joining, welcome. My name is Eric Gloniak, for those of you who I might not have had the chance to meet just yet. I am the chairman of the Young Executive Committee at the Tower Club. I'm also a senior vice president and commercial banker at Sandy Spring Bank. I've got my fellow leadership council for the young executives should all be on here. Hi, so nice to see your faces. I'm starting to forget what you guys look like. But we are thrilled to have Dr. Habib on today. Dr. Habib has been a contact of mine for several years now. And for those of you who have not had the chance to interact with him yet, you're in for a real treat. This is timely. This is literally, you know, potentially life-saving information. So we're very lucky to have him. Thank you so much for being here. Just very quickly, if you have not used Zoom yet, there is a chat box on the bottom. There is an opportunity to post some reactions. I'm sure there'll be some shocking faces and smiles and things like that. We are going to have a whole section for questions at the end of this. I expect there to be lots of thought-provoking things discussed, so please jot them down, put them in the chat box, hang on to your questions, and then at the end we'll allow it to open up for at least 20 or 30 minutes of Q&A. So without further ado, on behalf of the Young Executive Club, my friend, the wonderful medical professional, Dr. Habib.
All right, hi guys, how are you? Thanks very much for spending your Thursday afternoon. And I hope it's going to be informative. I wanted to be light and interactive. Subject is serious, no doubt, but I'll make it easy through a couple of examples so it's not too scientific. But I like to educate people, so I want people to see an angle that they may not have been exposed to. And so towards the end, I will tell you what take-home messages and some action plans maybe to make a difference in your day-to-day life. So, a little bit about me very quickly, because some of you know me, a lot of you may not know me. I graduated from the University of Sheffield in the UK in 1993. That means I'm old. And because there are a few people in front of me probably a little bit younger, but don't worry, I don't feel old and my nitric oxide level is really good. So that number one. Number two, once I graduated, I worked in the UK for a few years in fields like orthopedics, urology, those are surgical fields, emergency room medicine, and a little bit of psychiatry. And coming on to the stateside, I went through residency at the Bay State Medical Center in Massachusetts, affiliated with Tufts University for 3 years. And that was interesting because, we practice medicine on both sides of the Atlantic, but the way we deliver medicine in America is quite different. But I like to think that I've got the best of both worlds. So hopefully here we go and we'll get started. I've been in clinical practice since 2001 in my own office. I have an office in Ashburn and in Bethesda, and we are open, by the way. And we're doing remote consultations, we're doing remote physicals, even in-home physicals, just to start the ball rolling. So we're going to go and talk about the title. The title is really the connection between nitric oxide, blood pressure, and COVID-19. So, if I start off with something that's current on the news, which is that, first of all, in Italy, 25% of the people that died had one pre-existing condition, 25% of the people had 2 pre-existing conditions, and up to 50% had 3 or more pre-existing conditions. Of all the people that died, 99% of them had pre-existing conditions. The outliers, you'll see why they may be outliers because what I'm about to share with you. Now, let's fast forward to something that was in the news just last week, that the African-American population had about a 70% death rate once they were infected with COVID. And that may be because of underlying pre-existing condition, or what I'm going to concentrate on is blood pressure and blood vessel health. And so very quickly, I want to talk about 2 main things today. The problems are that whether you have high blood pressure or not, and should you have blood pressure, just lowering it is not enough. It's how you lower it. That's where number 2 comes into it. The association between nitric oxide and the stiffness of the blood vessel is going to be critical in talking about COVID and for future health of your blood vessels in every condition of your body. And so low nitric oxide bodes well for bodes badly for higher blood pressure and stiffer blood vessels. And a high nitric oxide gives you lower blood pressure and softer blood vessels. So I'm going to explain those in more detail, but that's essentially the two situations I want you to be focused in on. And what we will do is now go to examples of how to evaluate that. And towards the end, I'm going to give you my 5 pillars and some take-home messages. And hopefully with your questions, I can be more specific. But so now I want to go into the clinical evaluations of people with stiff blood vessels. Just going to just wait for something to come up here. And so what we have here is a report of somebody, interestingly, only 40 years old. I don't know if, can everybody see the image? All right. So that image is of what we call a central arterial monitor. You've got the individual, he's 5'8", he's 40 years old. You can take it from me, he's in pretty good shape. He's African-American, so he's in good shape on the outside, but is he in good shape on the inside? If you look at the top right-hand corner of that test, it's called the brachial systolic diastolic. That's typical blood pressure reading on anybody's cuff. And by any standard, that's high, 173 over 102. But as we go to the box on the lower left side, what we have is now the inside of the body. We've got the top line, which says SP. That stands for systolic pressure. That is closest to the heart. We call it the central arterial pressure. And the range that should be appropriate for somebody of his age is between 99 and 102. And he's obviously way above that, 155. If you skip to the third line, it says AP. AP stands for augmented pressure. And the range for this individual for his age is between 0 and 11. Because I'm 51, my range is going to be between 6 and say 14. It's going to be different. But for his age is between 0 and 11, but that's gone above the range. Now you may say, well, of course, he has high blood pressure on his arm. It makes sense that his pressure around the heart is going to be elevated and that augmentation is going to be high. It doesn't always follow like that. And I'm going to show you examples of that. But true to what you said, the arm pressure is high. The pressure on the heart, the SP, central arterial pressure is high. There is about a 15-point difference between the two. But the augmentation pressure is the one that's going to be more indicative of a stiff blood vessel. Because in my clinical practice, I see people with high blood pressure, but if they're healthy, they have low augmentation pressure. That means they have good amounts of nitric oxide. As you can tell, I'm going to talk about the relationship of nitric oxide in relation to COVID, and nitric oxide in relation to the blood pressure, and nitric oxide in relation to overall health and well-being. So the next picture, so that's the augmentation pressure. It's above the upper limit of normal for this gentleman. So even if he had high blood pressure, if he had softer blood vessels, I would be more encouraged that he would have a healthy nitric oxide level. I'm discouraged because for his young age, not only does he have high blood pressure, but it bodes badly because stiff blood vessels are what we expect after years and years of hypertension. So when people are diagnosed with high blood pressure, after 1 year, 2 years, we don't worry about it. It's after a decade or two of constant pressure that the blood vessels become stiff. But the fact is that low nitric oxide is far more detrimental because blood vessels are three-dimensional structures. There are many, many components to it. And even though I'm mentioning about nitric oxide being one of the major ones, I want you to understand that blood vessels are a three-dimensional thing, and the blood vessels are responding to something, whether it be genetics, whether it be inflammation, whether it be nutrient deficiencies. There are multiple reasons for having higher blood pressure. The problem of just lowering it is the problem is one-dimensional. There are medicines out there that are very active on the ACE receptor, which is the most beneficial group. Calcium channel blockers, not so great, and diuretics are almost useless when it comes to additional benefits of lowering blood pressure. So what I said about lowering the blood pressure is not the only thing, it's how you lower it. And if you can lower it by raising the nitric oxide, you're going to win at two levels. You have a healthy blood pressure, you have healthy blood vessel, and having high nitric oxide will make it difficult for the COVID virus to enter. Later on, I'm going to show you a picture, an image of the COVID virus, how it attaches to the cell membranes. And that's why I'm going to explain that in correlation to nitric oxide. That's why not only can you have healthy blood vessels and low blood pressure, you can actually protect yourself against the COVID and even mount a stronger response should you get it. Any questions so far? All right, so let's go to the next image of a central arterial monitor. And I'm going to look at that now. Okay, this is mine, and it's on a bad day. And let me go back to it. I don't mind sharing personal details. And for the sake of education, it's worth it as we get the information up. And because there are ladies in the room, I can't make any nitric oxide jokes. But men can actually know, they can figure out that they have low nitric oxide levels. And it's not the big bulging veins in the gym that we're talking about. And so as the image is coming up, okay. So can everybody see this image? All right. Oh, I got smiles on people's faces. I like that. So you know what I'm talking about. That's good. All right. So this is a 5 foot tall, I mean, really tall gentleman, me, and a very young 49. I'm 51 now. This is 2 years ago. And this was not even on a good day. So even though the arm pressure is 132/77, which theoretically is normal, it's much more variable. It depends on how much sleep I had, how much stress I'm going through. It's variable. If I have a fever, but the central arterial pressure, if you go down to the box on the bottom right-hand side, where it says SP, it's dramatically lower. This is more true blood pressure, right? This is around my heart, and that is more indicative of overall blood pressure and blood vessel health. And you can see it's comfortably in the normal range, even though it's not on a good day. Now the AP, the augmentation, the third line, AP, you know, when it is in the 13 range, it would be high, but my range is different than a 40-year-old guy, right? So I'm comfortably within that. But on a good day, I could be 2 or less. It all depends on my sleep. It depends on my activity. It depends on my diet. It depends on my supplementation. When all of it's together, I've got readings of 2 or less on my augmentation, meaning that I'm producing lots of nitric oxide. And as it would correlate, even the pressure on the heart would be a little bit on the lower side, maybe closer to the 109, right? 116 is comfortably in the normal range, but it's not good enough just to be in the normal range for me. I want to be in the best possible range within you know, physiological. If you're too low, that could be a problem too. So that's a normal one. Now let's go to the third kind of slide. And hopefully as I'm doing that, you can understand that it's not good enough to just have a reading of your blood pressure in your arm. You really need to know what's inside your body, the central arterial pressure and how soft are your blood vessels. That not only is good for your blood pressure, it's not only good for cardiovascular health, it's actually going to mitigate you getting the COVID. And should you get it, you'll get it, resolve it faster. This one's an interesting one because what I'm showing you here is somebody who is what, 30 years old. His brachial arterial pressure is totally normal, 128/82. Now let's go down to the bottom left-hand corner. His blood pressure around the heart is normal, but look at his augmentation pressure. For his age group, it's high. That's the hidden danger. So when I tell you that when these young people died here or there, they were not normal. To keep it simple, they had augmentation pressures that I would guess would be higher. But to be specific, I think they had immune dysfunction. When you have immune dysfunction, it's a broad terminology, which most of you may not be familiar with. And that could be for the next series, the next presentation, and the next presentation, is that when you have immune dysfunction, it usually comes with inflammation. And when you have inflammation, the blood pressure goes up to respond to the inflammation in multiple different ways. So this gentleman may be walking around with normal blood pressure, but in fact, he's not healthy. I would suspect that there's some reason why he has stiff blood vessels. One is lack of vitamin deficiencies, and I'll go over those with you with the action plan towards the end. The other one is he has some hidden aspects, a dysfunctional immune system, which correlates well to inflammation. So this guy warrants a blood test of some kind, or really a thorough history, right? If I get a thorough history, I'll be able to figure out his lifestyle. I'll start to build a picture of what I suspect. And oftentimes when you're an experienced physician, you already have a working diagnosis. Sorry, my mic fell down. You already have a working diagnosis of what's going on. And then I use lab data to confirm what I'm thinking, right? To confirm or refute. And so does that should sort of open people's eyes that without testing, you can't tell. It doesn't matter if you're 30 years old, 40 years old. In fact, I'm the oldest of the three examples. And I got the best blood vessels, right? That's a plug for myself, right? All right, okay. So, I mean, what's the take-home message? Take-home message number one, testing to look at your central arterial pressure, looking at the softness of the blood vessel. This is an investment that can not only save your life, it can slow down the aging process. You can't make nitric oxide by being unhealthy. It's not possible. You can't make nitric oxide if you don't have a good diet. You can't make nitric oxide adequately if you don't exercise. You get my drift, right? So the step two, it makes sense that you follow my 5 pillars. So I'm going to do it in reverse. I'm going to tell you what they are, and towards the end, I'll break it down for you. I'm sorry if I speak loudly. I just, hopefully everyone's awake and there's a smile. That's a good sign. No one's left the room yet. And so the 5 pillars, very simple. And I can give you science all day long about the 5 pillars. And so again, we can break the 5 pillars down on different days on subsequent weeks and make a series out of this. Number one, don't damage your sleep. For the sake of time, I won't go into it any more than that. Number two, don't put bad food into your body. You'll disrupt the ecosystem in your gut and your immune system will suffer. That's the beginning of immune dysregulation and the beginning of inflammation. And inflammation is not something that's written on your forehead. You may feel it with stiffness, aches, and pains, and your blood doctor can measure it. Doctor like me. Number three, put good food into your body. Because you want to nourish, it's not about nourishing yourself. It's not about weight gain, weight loss. It's about nourishing the bacteria, the microbes. And the microbes can diversify. When they diversify, they alter the signals in your cells. So you reprogram the cells to increase metabolism and reduce inflammation. And then the fourth step is to supplement. Supplement specifically related to nitric oxide, supplement to improve the immune system, subsequent supplements to maybe make the gut more healthy, and supplements to boost the immune system. It doesn't really matter which order you do it. If you're doing it like an amateur, that's no insult. But I would recommend doing it in a stepwise manner. And the reason being, the protocols that I have are scientifically based. What that means is that you have to prime the environment, then you reset it, to follow by reprogramming, so you get repair and regeneration. That principle applies to muscles, tendons, ligaments, neurological, that's brain-derived neurotropic factor, immune function, everything. So if you do it in the right order, you can really have a systematic, objective improvement in your function. That's your physical performance. That's how your body feels. It'll prevent disease. And for people who have disease, you will reverse it. At the very least, it'll keep you in a very good state. Not how you lower it's not lowering the blood pressure, how you lower it. It's not lowering the blood sugar, how you lower it. It's not lowering the cholesterol, how you lower it makes all the difference. So now let's change pace and then go back to, let me go back to why did the African American population have such high numbers? Socioeconomic group, fine. Lots of pre-existing conditions, fine. But I'm telling you, that 40-year-old that I showed you, he's a doctor. Yeah, I mean, he may have been poor before he was a doctor. He's doing okay now. It's not all about wealth. That's a big factor. But the African American population have always had a weakness for blood pressure because the genetics that they grew up with are different when they're exposed to the Western diet and the Western lifestyle. That's called epigenetics. I don't want to talk too much about that. But the point is that 40-year-old needs not only to lower his blood pressure, he needs to make that blood vessel softer. And so now how does COVID come into it? There's an ACE2 receptor. And I promised myself I don't want to go into the science too much because I'll make you a little bit confused. But that ACE2 receptor will be downregulated if your nitric oxide is good. Because the ACE2 receptor is something your body produces to combat high blood pressure. So if you have salt in your diet, your body wants to make more ACE2 receptor. If you have hypertension, your body's going to make more ACE2 receptor, even if you're controlling your blood pressure. Because we only control the blood pressure with the angiotensin converting enzyme blocker, which is still the gold standard. But then if I tell you that you can't just control blood pressure as a number, because there are other parts of that pathway which are called renin, comes from the kidney, angiotensin, which is in the bloodstream. Each of those are part of the system. So you've blocked one thing, but you can't expect to get the best results by just blocking one thing. because your body can sense all these deficiencies in vitamin C, in vitamin D, in magnesium, and it's going to respond. Yes, you've blocked that ACE inhibitor and you're going to get results, but your body's going to still upregulate ACE2. As I said, I won't go too deep. ACE2 is where the COVID virus comes in. So so what I'm saying here is that if you have soft blood vessels, that means that you must be doing something right. You can't make nitric oxide without having the right ingredients. When you have the right ingredients and your blood vessels soft, you won't stimulate your body's own production of ACE2. That's how the virus comes in. Can we show the picture of the ACE2 virus? I mean, the SARS virus. Now, without going too deep into it, I'll just show you the picture of the virus and the receptor that binds to the surface of your cells. We call that epithelium. So here, where the arrow is, right in the middle, is where you have the virus. And the spikes on the outside, you've seen pictures of it, is what is reflective of a coronavirus. We call that the S protein, as you can see. Now, there's an enlarged picture of the S1 protein where it would bind with this ACE receptor. This ACE receptor that you see right at the bottom is reflected on cell surfaces. So which cells have ACE2 receptor? Your lungs, right? That's the way people die with COVID, the ones that die. But you have ACE receptors in your heart and blood vessels and intestines. And specifically, not just the lung, but you have blood vessels around the alveoli. So there's two areas that the ACE receptors are there. And what happens is that this binding site, RBD stands for receptor binding domain, is that when you have low nitric oxide, you also have what we call hypoxia, lack of oxygen at a molecular level. That allows that virus with this RBD, this receptor binding domain, to stick to the ACE receptor more readily. Okay, everyone following to some degree? So if you can increase your oxygen, and you can do that by raising your nitric oxide level, then the virus can't stick to the ACE2 receptor. Number one. Number two, remember what I said about upregulating, downregulating. If you don't control your blood pressure holistically, that means not only the blood pressure, the reading on your arm, but the softness of your blood vessel, your body's still going to stimulate ACE2 receptors. That's not conclusively proven, but I'm going to tell you in clinical practice that's the case. Because there's a difference between lowering the blood pressure, and you can do that with medication supplementation, but where you see somebody with a controlled blood pressure and soft blood vessels, you know you've done your job right. Conversely, you lower the blood pressure, but the blood vessels are stiff, you haven't done your job right. And the only way to know is to be tested. Does that make sense? Measuring it on your arm is not good enough. Okay, so where are we now? So I will get rid of this image and just go back to like normality. So what are the key ways that we can, make your own nitric oxide, right? So that's the kind of question people would have. And as I said, nitric oxide doesn't work by itself, but just for the sake of simplicity, we're going to talk about nitric oxide. The most powerful way is probably from exercise. And endothelial nitric oxide is one way of producing it. Your nerves can produce nitric oxide. That's why those people that can't smell or taste, there may be a defect in the nitric oxide production at the nerve level, because your body can make nitric oxide at the nerve level. And then there's nitric oxide that's made on the immunological level. So when your body's under stress, like an insult from an infection, your body naturally, through the immune system, creates its nitric oxide. So that's why nitric oxide isn't just for blood pressure, it's a reflection of your immune system. It's a reflection of your health of your blood vessels. As I mentioned, when you have poor blood vessel health, what happens is that not only can you get blood pressure and heart disease, but you have more chances of death, right? That's the bottom line. Why are we lowering blood pressure? Why are we lowering sugar? Why are we lowering cholesterol? Because we want to not die prematurely. And the next part is we want to live well. Lowering those numbers, number one, doesn't guarantee you're not going to die prematurely. It lowers the risks. But if you want to live well, then you need to add the other component, which actually will lower those parameters of disease much more effectively and give you health. And so the 5 pillars are what they are, but we're going to concentrate on the powerful ways to raise your nitric oxide. One is exercise. So cardio exercise, 20 to 30 minutes, 3 times a week is reasonable. And for people who are just starting out, well, look, do 5 minutes 3 times a week. Then that becomes 10 minutes 3 times a week. And then after 3 times a week, ideally get to 20, 30 minutes, if not more. And then once you do the regularity, then you can do it more frequently. What happens is people challenge themselves too much. They'll do like 2 hours in one day and then they're burnt out and they can't do it the rest of the week. That's not a good idea, right? So slow and steady is the best way. The next way of producing nitric oxide is having rich leafy vegetables in your diet, right? So any greens, all greens, don't worry about it. And then in addition, things like watermelon and cantaloupes have high citrulline. So both of those are different mechanisms of making nitric oxide. So the citrulline is part of the arginine cycle. That's one way to make nitric oxide. And when you eat green leafy vegetables, you have nitrates, and your bacteria in your gut make nitrites, and then acid in your body from your stomach can release nitric oxide. So that's how you do it. And then the more complicated way is how you can stimulate your immune system to be involved with that. So it's just as important to have the right systems in your liver, because the liver is not only core for detoxification, for carbohydrate metabolism, for fat metabolism, protein synthesis, all the above, including nitric oxide production. And your immune system is connected between the gut and the liver by itself is a powerful immune system. That's why, people, particularly in the medical world, don't understand just a mere absence of a disease. Like, you don't have liver disease. Okay, that means your liver's perfect. Hell no, that's a ridiculous statement. There are other parameters, and sophisticated doctors, guess who's sophisticated? Now, sophisticated doctors have subtle ways to break things down and give things in an objective manner, right? Objectively look at everything. Function is not just this black and white thing. Disease is. We have a cutoff. You're above it, you've got disease. You're below it, you don't have disease. But mere absence of disease does not make you well. There are many stages of cell decline. We want to get to find out where you are and objectively show you how to reverse it, okay? And then, the other way, so as I talked about, immunological is definitely part of the way. That's nitric oxide. One of the big take-home messages you might want to learn about is vitamin C. So whenever somebody's sick, your vitamin C level drops. So it makes sense to replace it. What they found since the COVID-1 infection back in 2003 and 2004, they started researching nitric oxide then. So things I'm telling you now is not something I just discovered now. This is research that's been going on for over a decade, right? And with that, they found that vitamin C did two things, particularly intravenous vitamin C, high dose intravenous vitamin C. The levels went up, but it supported nitric oxide, because in order to produce nitric oxide, you can't just put the nitrates in and just exercise. Sometimes you have to have cofactors. And vitamin C supports the cofactor, the body can release the nitric oxide. Everything works in 2-3 steps. In medicine, we're like, blood pressure high, here's a drug, 1 step, boring. Number 2, high cholesterol, here's the drug, lowering it, boring. The body doesn't work like that. It works in 2, 3, 4 steps. You have to be fast. You have to be thinking all these things at the same time. And then, so what we're saying here is that the high dose vitamin C not only replenishes the vitamin C when people are sick, and the sicker you are, the lower it's going to be. By the way, the animal kingdom, they can make their own vitamin C, up to 100 times in sheep studies, but we've lost that ability. So we take it, right? So it's fine to take oral, but IV is a very powerful way, because what it does is that they showed that it supported the nitric oxide level to the point that they proved there was an 82% reduction in viral replication. They proved that in epithelial studies on monkeys. That's the reason why I'm professing that lowering the blood pressure by itself, without addressing the softness of the blood vessel, which is reflected by nitric oxide level, is not adequate. I'm not saying it's a mistake, it's not adequate. And for people who think they have normal blood pressure, look at your augmentation. And for people who have normal blood pressure and normal augmentation like me, I want to make sure I still support that system with my 5 pillars, as I mentioned, and then I supplement. So that's why I know that my augmentation can be even lower than 6. It can be 4. It can be 2. And so what we're talking about. And so, I'm sure at the end of it, you might want to ask me questions about preventative with zinc and quercetin. I just didn't want to make it too complicated on one sitting. And then that's for preventing. And then if you get it, how can you recover fast? Zinc and quercetin, those are fine, but that's where the IV comes into it. Now, I would do the IV even if you don't have sickness, because I guarantee there's no normal person out there. And if you're being immunologically challenged right now, you can be sure that stress will immunologically challenge you, anxiety, depression, interrupted sleep, being stuck at home with family, any more females and with spouses. Anyway, stress, anyway. So sarcasm aside, I think on a serious note, where is it that you can find no stress, right? So you always saying is let's build yourself up, right? So IV vitamin C has been proven to raise the nitric oxide level, and they showed the animal studies where they stopped the replication of the virus. And in New York, because of these studies, they were using a combination of other therapies for the ICU patients, where they were using high-dose IV vitamin C 4 times a day, and they had more survival. Almost everybody made it out. Whereas where normally when you get to the cytokine storm, there's a high mortality, almost 80% mortality, okay? So hopefully a few things should open your eyes that why did so many deaths in the African-American population? Why do young people die, right? Because they're not normal, that's it. And that pre-existing condition is what is the biggest risk factor. So make your body healthier is the way to do it. And for a physician like myself, an MD, I will tell you the best way through medicines if necessary and naturally. You want to do it in a 3-dimensional way so you get the best results. Not only will you be able to control the disease factors, your diseases won't progress, you may even reverse it, you'll become healthy, you'll be able to perform better at your workplace, at your gym, your mind will be clearer and more focused and sharp. Your brain, so my brain processing speed is as sharp as it's ever been. It's sharper now than it was 10 years ago because I'm taking more efforts in cleaning my diet, in supplementing and supporting the brain, right? So another occasion, I'll tell you about evidence that I have about the blood flow in the brain through brain scans that we do in our office, how sleep can make a huge difference, how stress and anxiety and all these disorders, they reduce, either they cause the blood flow in the brain to go down or lack of blood flow creates that problem. So 2 action plans, if you know the summary of what I was trying to say, is testing to look at the softness of the blood vessel, which is indirectly looking at nitric oxide. There are some lab ways also, we call it ADMA, asymmetrical dimethyl arginine. The other one is the 5 pillars of health. Don't damage your sleep, don't put the bad food into your body, eat good food, and supplement. So another day we'll go into the breakdown of good foods. Another day we may go into other global supplementation for the gut, for the immune system, for the liver detox, things like that. And believe me, everything I tell you, I'm going to tell you with objective numbers and scientific facts. This is not a nutritionist. This is not a naturopath that's going to give you general stuff. I use it in my clinical practice, and everything you saw on my presentation is a real life patient. And everything I will show you moving forward is real life patient with real results at reversing blockages, with real results in lowering blood pressure, with real results in reducing autoimmune disease, okay? And then so the aim would be to look at that. So if you're interested in this testing, just call me and we'll talk about it. And then as far as IV vitamin C, as I said, you don't even have to think about it. You could do it as a preventative, but should you have specific questions in mind, we can talk about testing all nutrients, whether it be B vitamins, antioxidants, vitamin C is an antioxidant, minerals like magnesium are very critical in lowering the blood pressure. And you want to make sure that you support the vitamin D to not stimulate renin, which stimulates blood pressure, right? And vitamin C actually blocks one of the receptors. So I have some questions already, and I think that we can continue the conversation, no doubt, but I think that answering some questions would be good. How are you different from a cardiologist? Okay, I'm the best doctor out there. So a cardiologist controls disease, I reverse it. Let me give you an example, my friend. So that's the best way, right? And then I'll bring you the patient. Oh, somebody came back. I thought I lost somebody. I felt so hurt. My heart almost broke. All right. If you didn't catch it, so how are you different from a cardiologist? I said, I'm a real doctor, first of all. They're just plumbers. So I had a guy with 2 stents, 3 stents, 4 stents, 5 and 6 stents. Then he ends up with a bypass. Then he finds me. And so you may ask, well, you know, if the cardiologists did their job right, why did they have so many stents? And how come all the stenting in the world didn't stop them needing a bypass, right? And he had a heart attack in the process. You're following me so far, right? Because they didn't adequately test what the culprit was, right? The devil's in the detail. It wasn't the high cholesterol, because he never had high cholesterol. He was still on a cholesterol-lowering pill. It wasn't diabetes, because he was not diabetic. It wasn't high blood pressure, but they put him on a little bit of blood pressure pill. The problem was a lipoprotein called lipoprotein little a. So while people are chasing cholesterol, wrong path. While people are chasing LDL, half right. is the dense LDL that you chase. Lipoprotein is the densest LDL and the most atherogenic, and he had it. So no wonder they couldn't stop the blockages. They never addressed it. And you can't address it with a prescription medication because they had him on statins, lipid lowering medication. They had him on some blood pressure pills, didn't do it. You know, just giving more of the same stuff doesn't give you different results, right? This is where I get a little arrogant and I show off a little bit, swagger. But let me give you an example of what I do. So I had somebody unrelated, but you can understand the same principle, that his calcium score kept on going up. This is before he came to see me. He himself took proactive steps. He changed his diet. He had a little bit of insulin resistance. He was very educated. By the time he came to me, he was very educated. But his calcium score went from 200 to 400 to 600 and gone up to over like 899 at one point. So whatever he was doing, and he had a cardiologist too, and they said, you don't need to test it at 400. You're on the right treatment, you're good. But he wanted to test it. He kept on going higher. And he's another one with dense particles. He had insulin resistance, not diabetic. So that's what I mean, devil's in the detail, right? Insulin resistance causes blockages, oxidation causes blockages, inflammation allows blockages, dense particles cause oxidized LDL causes blockages, and you're chasing what? Cholesterol. What are you chasing? LDL. Even when you lower it, you still have disease. You're just controlling it. I reverse it. So what I did was use a combination of therapies to get rid of his insulin resistance and find a cutting-edge therapy called chelation to help mitigate risks. I can't tell you I reversed his heart disease. All I can tell you is that his calcium score went from 899 to like 450. And then I plan to bring it down to 300 and then back down to normal. Does that kind of answer the difference between why I may not be a cardiologist, but I get results? You don't have to be a cardiologist. You have to be a cardiologist if you're the guy that's been trained to put the stent in. Absolutely. You have to be a cardiologist if you have arrhythmias that you have electrical pathways that need to be burnt, electrocauterized. You have to be a cardiologist if you want to be a specialist in something. But the best specialist is one that prevents the disease. And the better doctor is a Chinese proverb. A good doctor diagnoses, a very good doctor treats, and the best doctor prevents it. So if you can't prevent it, then reverse it when you get it. Okay, so the process of testing nitric oxide and soft blood vessels, steps we should take. First, get it tested because you may already have soft blood vessels. The good thing about natural products, you can't go too low. And then when you, the other benefits of nitric oxide is that it supports the immune system because it is part of that immune system. That's why not only is it good for the blood vessels, we call that endothelial function. The IV vitamin C produces nitric oxide. The combination of the two protects the blood vessels. That's why there's less deaths with the people in the ICU with COVID who are getting concomitant IV vitamin C treatment. So how do you know it's adequate outside of testing? So for men, I'm sorry, I'm just going to just say the way it is. I'm a doctor, so everything is medically prescribed. That means that if you have soft erections, you have low nitric oxide. And if you can't maintain your erection, you have low nitric oxide. And so that is not only a poor man's test, that is actually almost parallel. So I can almost, you know, one day I'll actually give people a measurement. You know, like people have a scale for your stools, right? Does it look liquidy? Does it look formed? And it's real because when it's sludgy, you have inflammation. When it's pellety, you have constipation. So just like that, you can probably have a way of measuring the penile strength. So without doing a special blood test, you can actually probably correlate it to nitric oxide. But I don't think people are going to line up for the penile stress test. I think they're going to line up for the endothelial function test, which we call the central arterial monitor. There's a plug for my central arterial monitor. But should you want to embarrass yourself, come on over. I'll do a penile stress test for you. That's a joke. I'm not going to do that. I'm a professional. I wear gloves. Okay. Do you have? It's a small group. I can be funny. You know, kind of be funny. I promised myself I wouldn't make a fool of myself. Obviously, leafy greens. Thoughts on meat or no meat. Look, it's complicated because I think majority of the people do better with less meat. I think. There is a small group of people that actually do well on meat. I'll tell you why. You can get clean meat, right? So that's the thing. You have more concentrated nutrients for sure, because you know that animal ate a whole bunch of greens to produce that pound of meat. So it makes sense. The nutrients are somewhat more dense, right? But if you choose the clean one, grass-fed, you know, and I wouldn't overdo it. So there is a place for it. But I'm just going to give you my personal experience that it sort of clogs me up. When I have greens, it opens things up. But like I said, I think there's a place for meat eaters, but they're a small group. So don't make yourself believe you are one of them just because you desire it, right? So, and it's a balancing act. So I would say that, look, you can get a lot of good fats from plant sources, whether it's the avocado or the seeds and the nuts, whether it's coconut oil, whether it's fish. So fish is another high quality protein and good quality fats. So I think we move to greens, to meats. Hopefully that gives a general answer. We can definitely talk more about nutrients and nutrients down the line. How can I get an appointment? That's what I want to hear in my Bethesda office. So very good. Just shoot me an email, and you'll see links with my office phone number, email. You've got my social media contents there. So you see lots of videos about stuff. And then so just reach out and feel free to do that. And then next, will you talk about, of course, yeah. So what I'd like to do with Eric's permission is have a weekly series of this. Hopefully more people join on. And I'll take you through the A to Z of health, right? Because sometimes people forget I'm a real doctor. So not only can I diagnose disease, I can predict it. So if you're smart, you'll listen to me. And there are ways to do that. I do that with my executive physical. But should you not do that and you come up with pre-diabetes or early disease, don't worry. I can reverse that, almost guaranteed. And then if you have disease, I can also not only reverse it, I can definitely mitigate it. But I'll do that by making you healthy. So remember, when I make the blood vessels softer, you're going to get better results than just lowering your blood pressure. When I get rid of insulin resistance, not only the blood sugar is better, you'll have less heart attacks and less blockages. And all these people that keep getting blockages and heart disease, they're not testing for the right stuff. You can do 1,000,000 tests, the wrong test, you get the wrong answer. If you don't make good assessment, then every decision making is wrong. So sorry if I sound arrogant again. That's where the British training comes into it, because I have a very logical way of doing things. I don't overly rely on testing. I have a great deal of experience, so I get a good history, and I use my testing to confirm what I know and sometimes refute. Okay, so you can do both. And then I'll use data to tell you where you're starting and where you're going, and use metrics. And just to let you know that even when things are not going well, metrics is still good, because you need to know things are not going well so you can make a change. There's nothing wrong in a doctor saying, it's not going well. The doctor that only gives you a rosy picture, All right, what's the next question? Is there real benefits to drink a hot herbal tea? Yeah, you feel better right away. You put a squeeze of lemon in there, put some slices of lemon. I mean, that's the what do you call it? That's the not Ayurvedic, homeopathic, right? Sometimes you don't have to have large quantities, right? The skin of the lemon and the lime has essential oils. I don't know the mechanism, but it's very refreshing. And warm water, hot water helps the kinesis, helps the intestines move. Cold water not only decreases blood flow in the stomach, it'll freeze everything up. So for the people who love ice stuff, just choose when you have that. So throughout the day, when I'm intermittently fasting, I'm drinking warm beverages where I can, because it helps me think, I enjoy it, and it's good for my gut function. And do you accept insurance? So we don't, and that's not because of, let me tell you, insurance covers for disease, it really doesn't cover for wellness, number one. Number two, mine is so cutting edge, they wouldn't even know how to reimburse me. And so we have our own breakdown. And the value is on results. If you get the results, I'm worth it. If you don't get results, I'm not worth it. And merely controlling disease is not the way to, is not good medicine. In fact, my things, the way I practice medicine, I've been doing it for so long, I will standardize the new standards. And of course, I'm not going to try to change Johns Hopkins' way of doing things or Georgetown way of thinking, but people will come to a platform that works, and mine works. I mentioned to Eric about the Netflix series Game Changers. Interesting. You know more about that? Next we'll talk about. So plant-based diets, we'll talk about that. Any other questions? Anyone want to go live? We can go live. Can we do that? I have a question, Dr. Habib. Go for it.
So when you take, like, if you just, I convince myself I take over-the-counter vitamins. You mentioned like the process of like priming yourself to be able, I'm assuming, to actually absorb those vitamins. Is there like, is it like you eat food and then take your vitamins at that same time, or with water? Or can you talk about that?
Great. Yeah, so remember from my 5 pillars, supplementation was number 4. So eating the right foods, because foods come with cofactors. They come as a whole form. So I'll just use an example. When you take vitamin E, the nature produces mixed tocopherols. There's tocotrienols and tocopherols. There's four of each. They're mixed. That's the way nature intended. So the least harm that you can cause to somebody is by giving them a mixed tocopherol and tocotrienol. in your supplementation. But it used to be that, not that we were wrong, but we didn't have the knowledge. We used to use alpha tocopherol, thinking that was better. So now what we found out is that tocotrienol, the gamma, is the most effective at being a powerful antioxidant. So the blood pressure that I showed you of the young 40-year-old who's a physician, who has high blood pressure, stiff blood vessel, actually has oxidized LDL. Vitamin E in that form will lower the oxidized LDL because this form of vitamin E, it donates electrons. It donates electrons and stabilizes oxidation. Oxidation is an imbalance of electrons. So people who are not into molecular medicine, they ought to be. Lowering the cholesterol, blood pressure, and sugar is not the end all or be all. It's much more complicated than that. And that's why when you don't sleep enough, you're creating immunological instability, oxidation, inflammation. You have instability. When you put the wrong foods in and have toxins and heavy metals, they're leaching electrons and making things unstable. All the structures in your body are made of membranes. They're fatty structures, like your brain and your cell membranes. And cholesterol is involved. So cholesterol is not bad, you need it. Have healthy fats, including animal fats, but clean sources, fish sources, right? But it's that oxidation. And as I keep telling you, that blood vessels are stiffening up, not because they just want to give you blood pressure. And it's not because of genes. I have genes and it's not stiff. I have genes, it's not, I'm not going to get blood pressure. I have genes for blood pressure and inflammation. When I get the inflammation, I get rid of it. Because that inflammation would lead to high blood pressure. I don't allow either one. Because the number one cause of heart attack is inflammation. So I changed the subject a little bit. But so going back to supplementation, just complete that answer. Be a little bit careful, get good brand names. And there is some difference in the formulation. So you could take a magnesium, which type of magnesium? You can take a vitamin E. I just told you, you better not take a vitamin E because now we have more science. So look, you're talking to a professional. If you want to do general, you can. But I will, at the risk of insulting you, I say, talk to a professional and every decision you make will be a better decision. And put your other stuff down. Sorry, that's a joke.
Dr. Habib, I'd like to just take a second, and I've been taking your immune boosting power pack, which is outstanding. I know you're probably not going to promote it, but I would like for you to talk about it just a little bit because I found it to be, you know, pretty affordable for a power pack and something that has been really outstanding since I took it. I get seasonal tonsillitis. Had about the first week of April, and it was 3 days as opposed to 10 or 15. And so just if you could just talk about what makes that vitamin C complex that you put together in there a little bit different than just taking a normal vitamin C and the other things that are in there.
Eric, you're a good man. You're a good man, but let me do it in reverse order. Let me show you the power. Because it's a small group, I can make any claims I want because number one, you can trust me that I'm telling out a fact. When I get a bacterial infection, I got somebody tried to contradict me. It's like everything I say is based on facts, so you can't contradict me. But of course, I have a medical license. I have to be very careful what I say. I'm in a small group here, so I trust that you keep this quiet. When I have a sinus infection, most of the time I don't need an antibiotic. When I have a strep, I don't need an antibiotic. Most common infections, I can get rid of it with IV vitamin C. That's the power of IV vitamin C. You don't have to wait till you get COVID. You don't have to wait till you have shortness of breath. You can use the power of IV vitamin C to not use antibiotics because they'll destroy the gut flora. So that's making the statement, the powerful statement, what I just said. Now what Eric is saying that, look, we're almost skipping by going to the immune system, but because this combination is designed, from my experience, to be most effective, synergistic, it'll give you the short-term benefit. The best way is to make sure that you understand the immune system from the gut, the microbes, the signals that come out, the liver health, and then immune system. So if you're going to think of 3 systems, this is the 3 systems you should think about because it works for me. And if it works for me, you can be sure that it's going to work for a lot of people. Gut health, which is dependent on the brain and sleep and stress and everything like that. Gut, liver, immunity. Even though those 2 affect the immune system, but what I gave with the supplementation is just on the immune system. But I like people to see the benefit, have trust in it because everything I put in is bioavailable, methylated, in the right proportions, right? I usually like to test people, and then what I like to have people is to understand about maintaining that good gut health. Even if it's good, make it better, right? And then the people who say my liver enzymes are normal, not good enough. What's the function of your liver? And I'll give you, when the time is right, I'll give you some amazing clinical situations and you're gonna say, that was with a vitamin, but even the doctor doesn't know he's using a vitamin because it's called a prescription. It's actually a vitamin. Any other questions? Well, the 3 packs. So the starting pack, even though it says basic, it's not basic because I don't have a basic where it's a 1 pill. You know, some people profess 1 pill, magic pill. There's no such thing. But the next power pack is combining 2 systems together. The final is, combining 3 systems together. So it's really the best remote way of helping people. But for most people who come in and get tested, we actually can work in a systematic manner of priming, resetting, reprogramming, repair. So once we get into that zone, we stay in that zone and so adjust it accordingly. Any other questions? Any live questions? And if not, then I can, anybody with any family issues, family questions, or something you heard on the TV. What was interesting about the TV, about testing, anything on testing for COVID?
Well, Dr. Habib, I'd like to just say, so Robert asked if you offer vitamin C IVs in your practice. The answer is yes. I've seen you do it 100 times on Instagram and I think a variety of vitamins. So talk about that. And then Lisa asked how long the packs last. I think that's 2 months supply, but I'll let you comment on that as well.
Correct. It's a quick answer, 2 months supply. So it really will help you. 1 month is good, 2 months is better. 3 is the golden period to really get to the nitty cellular level, right? And then IVs, look, as a trained physician, I can't make the claims, right? I can't make the claims that I treat cancer and prevent cancer. I can't make the claim that I reverse heart disease. I can make the claim of preventing heart disease because that's standard of care. Lose weight, lower blood pressure, but even that's substandard. I really can prevent those things. So some of the IVs are my, the step 5, right? My 5 pillars are sleep, don't put bad stuff in, eat good food, supplement, and then use power infusions. So my power infusion can be customized. So I just gave you the importance of vitamin C, but I use glutathione, a powerful antioxidant that detoxifies the liver, B complexes, B12, amino acids. I have athletes. So we customize it for the needs and what's the target system that I'm trying to address. And then those, the one I told you, I reverse the blockages. Again, I can't make the claim of reversing the blockages, but I reverse the calcium score. Let's put it that way, right? But I won't even make that claim because, you got all these haters out there that, have issues without wanting to come and look at the results and how we do it. And even now, when there's IVs in the sepsis unit showing great results, IVs in China, IV vitamin C's in New York showing good results, they're just so stuck in the old way. They're not willing to adapt and learn and incorporate. So the other question about the IV is that I use chelation, and the NIH has studies. So the good news is that I use evidence-based wherever possible, and then I've been in practice long enough that I can customize it. So do I offer IV vitamin C's? Yes, definitely. Do you have packs for? Yeah, gut health. There's a package for gut health. So we work at the enzymes in your gut with optimizing the acidity in your stomach. We look at the diverse bacterial flora with a good probiotic. We use immunoglobulins or things to protect the lining because that's where your mucus lining protects you and where immunoglobulins, immune system are created. And then you have to have amino acids to make the gut, which is the muscle, very, very tight. So hopefully that helps. So gut is a problem. My right-hand man is very good. So the digest has what we call betaine. It's helps you with donating methyl group, which is very good for detoxification and lowering homocysteine. But that betaine chloride is hydrochloric acid. It won't burn you. If you have problems, call me. You won't have a problem. That's a joke. No problem. It's not that kind of acid. And the gut health is the amino acid called glutamine, 4 grams of it. It's combined with other things for better absorption. The GI boost is the non-dairy. We have dairy products, but we prefer non-dairy for most people. Is immunoglobulins that we extracted from bovine milk, but we took out the dairy. And the biotic is probiotics to give you diversity. Diverse bacteria always give positive signals like reduced inflammation and raising metabolism. Combination is always best. So great questions. And then what do you say about drinking hot water, lemons? So I think I answered that, but warm water with any herbs. You could put mint in there, peppermint. You could put any herbs in there. I think it would be beneficial. And lemon and lime are very, very good. A very concentrated lemon and olive oil is supposed to detoxify gallbladders as well.
We also missed one, Dr. Habib, on from Matt on iceberg lettuce versus spinach and kale. And I think a lot of people sometimes struggle with what is a leafy green. And if you could touch on that for us, because that was the top thing you mentioned other than exercise, was creating your own nitrous oxide.
Eric, you should be sitting right here, my friend. I wish I could afford you. You could be on my payroll. Wouldn't $1 work for you? All right, my friend. So listen,
Thank you.
that's a fantastic question. Fantastic question. You know, the people who give good questions are really smart people, because giving answers is the easy part. So green leafy vegetables, you know, anything green. So the family of kale, Swiss chard, collard green, spinach. Let me just say spinach, because, you know, try to get organic, because spinach is one of those delicate leaves, so they try to spray it. You know, kale is less chemically influenced. So I would say that not only is it rich in nitrates, which make nitrites, and then you can produce nitric oxide, but it has fibers. The fibers will be fermented by the good bacteria, and they'll flourish and create short-chain fatty acids, and then that will give positive signals. And then, well, as we said, they have minerals. They grow in the ground. So the minerals like magnesium is good for lowering blood pressure. It blocks calcium channels. That's why we have a drug called calcium channel blocker. Magnesium is your natural way, but you have to have the right levels of magnesium. And then you'll have zinc, you have copper, you have selenium. You have a diversity of minerals from soil. And minerals help you stay alkaline. Alkaline will keep the environment so that you don't get inflammation. It's never, remember, one-step process. There's not just a one anti-inflammatory. It's a state, right? It's a state. And as far as leafy vegetables, so when you talk about the salads, I think it's good because you have a lot of these baby kale and baby spinach. They're ideal because they're organic in most cases. So I mix it up with raw. Now be careful with overdoing raw. Some people just have a raw diet and they juice a lot. Juicing means things get refined. And refined means the sugars come out in abundance. So be careful about that. And the next one is raw foods, because our evolution has made us a little bit weak, right? We don't produce vitamin C anymore. We can't sort of break down the raw foods as easily, so raw foods may have more nutrients, but you will demand detoxification. So your ability to detoxify will go down if you constantly take raw food, right? So it's good to mix up cooked food because they're easily digestible. Sure, there's maybe fewer nutrients, but our system has evolved to be to the cooked food now, right? So don't try to have raw foods too often because you're going to put too much demand on the detox system. And you do need the detox system to keep the chemicals out of your body. So for people who think that you don't need detox, you better think again. You have xenoestrogens through the wazoo. That's why men's prostate gets bigger. Women's hormones become dysfunctional. It's not about having periods. They don't feel good, the weight gain. So it's the environmental chemicals. They mimic hormones and they are called hormone disruptors. They specifically disrupt receptors. So the liver is your main place for doing that. But on one hand, eat the good nutrients, have some raw, but don't overdo it because your liver is necessary to detoxify. And that's why I believe in nourishing my liver. Some people need more nourishment because some people's livers are a little bit toxic. We have a blood test called gamma GT. Again, doctors wait until the liver numbers are through the roof. You can look at the ranges and interpret them. The liver enzymes like AST, ALT can indicate fatty liver. You don't have to wait to get fatty liver. You don't have to wait for an ultrasound to see fatty liver, right? Hopefully those give some clues as to green leafy vegetable, but try to have a diversity of it. You know, one of my kids, just like Caesar salad, you know, it's like, I'd rather she ate what she liked, but over time, I'm going to just throw in a little bit of the Swiss chard. I'm going to throw in a little bit of the spinach, try to get her taste bud used to a variety. And you know, like anything, once you do it a little bit regularly, then they adjust to it and it will all works out good. All right. Any other questions? So I'm having a really good time. We have more time, you know, I'd love to make sure that in future we do enough time for the presentation and enough time for question and answers. So there's another question: do you work with fibromyalgia cases? Yeah, autism, fibromyalgia, autoimmune disease. These are all dysregulation. So fibromyalgia used to be thought of something in the brain. It's called an abnormal brain scan, and gives a lot of physical symptoms like fatigue and aches and pains. but really it's an immunological dysregulation. So you have to work at the gut level, the liver level, the immune level, the three things I said. And so the metrics will give us an idea of which things are more or less dysfunctional, right? Not everybody's equal. Two people can get exposed to the same thing and one suffers. So let me give you an example. So I believe the CDC come out with safe levels of mercury, lead, and blah, 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 right? Guess what? They've got rid of it now. Is there a safe level of any of these? Hell no. The answer is no, there is no safe level, because even a minute amount can be a dysregulator. And some people just have the genetics to be able to tolerate that more, and some people don't. I told you I have bad genes, but doesn't mean I'm going to get anything. Well, I mean, touch wood. God willing, I won't get anything. But I'm going to do my best to make sure I flush out the toxins. I'm going to support my immune system. I'm going to keep my gut clean. Even now, I'm in a quest. Even though my bowels are good, I'm in a quest to make sure my gut is as good as it can be, for obvious reasons, right? And then your thoughts on Vitamix. Yes, Vitamix is better than the juicer. Anything that takes out the pulp is not a good idea, right? And I think that the evidence is coming out. Before I used to just have a hunch it was not good. And I have evidence about collagen and strength of collagen. Again, my clinical judgment sometimes has to be there when evidence isn't there. I've always had a bad feeling about juicing. So what happens when you have the whole fibers, not only is it the fiber good for you, now we know that the fibers feed the microbes, and the microbes are the ones that determine positive or negative signals. And so I'm against juicing, by the way. A little bit maybe here and there, great. If you have a concoction that's like a super green, go for it. But remember, you're refining it, right? So you take everything, including peas and carrots have sugar, but even leafy vegetables have sugar, small amount. But if you concentrate and just have the juice, you're getting refined sugar, those signals, right? I think I was talking to somebody this morning. I was explaining that my insulin levels are super low, because if my insulin levels are super low, then I can't get inflammation. Insulin turns on inflammation. And because I have diabetes in my family, if I keep on churning out all my insulin, I'm going to lose it. Then I'm going to get diabetic, right? I won't be able to control the sugar with the amount of insulin that's reserved. And then eventually I lose that, then I'll be on insulin. So the point is that, refined stuff makes your body surge insulin. There is never a good situation for that. And when you're a runner and you're an athlete and you say, where's my sugar? Your liver will produce it. So don't worry about it. And then all the supplements are gluten-free, correct? Oh, question, sorry, go ahead.
No, I was just going to say, we could go, I have a feeling, for probably another hour with just Q&A, but out of respect to Dr. Habib and respect to everyone else, I think that we should probably wrap it at this point, but it sounds like there's certainly enough interest to do this again, and Dr. Habib has expressed his willingness to do this with regularity. So Dr. Habib, with your permission, I would love to hear from everyone who was on the call about what you really liked, what topics you were interested in, and then I'll communicate back to you, Dr. Habib, and we can plan this perhaps even as early as maybe next week to do another one. Any questions specific to Dr. Habib? Right now on the screen is all his contact information. I text him regularly. Please reach out to him. He will give you his time, answer questions, and allow you to come into his practice to help, or direct you to help with your current provider. So I just want to thank you again, Dr. Habib, for your time, your effort, your knowledge. We're lucky to have access to you, and for everyone that was on the call, and to the rest of the Young Executive Leadership Council who's here that helped us. Cooper, do you have anything that you want to say in closing at this point?
No, I'll just echo that. I mean, Dr. V, this is wonderful information, and I mean, I couldn't, believe enough in preventing it and treating it. Coming from I'm a financial advisor. If we can prevent happening later down the road, that is so much more better than trying to implement something on the back end. So preventing it, disease in general, and good health is important. And I appreciate you spearheading this movement, and it was great today.
I'll get back on. Am I back on? All right. As always, Eric, thank you for allowing this to happen. And Cooper's right on. And, I hope it was interesting. I hope I didn't offend anybody. And we can definitely make it more entertaining. Spread the word as well. And if I can answer any, touch base, and we can answer things. Hope to be able to do this on a weekly basis. I enjoy it. Hopefully you enjoyed it.
Thank you, Dr.
Thank you, Doctor.
All right, you guys take care.
We'll be in touch.
Thank you.
Thank you.
Bye-bye.
Take care.